This is a brief introduction to a personal trainer who came to see me from Chicago, and he had a 15-year plus history of left foot pain. And he had a good awareness of his problem, but in spite of that, seen two different podiatrists, having surgery to the big toe because it didn't extend. That did not help his lateral ankle pain, and had custom orthotics made, saw two physical therapists for extensive visits, and a chiropractor. And he writes very well, very thorough in his narrative that he sent me before seeing him. So I'm going to read that narrative, and I'll just read a couple of paragraphs, a couple of key paragraphs to introduce his case, and then he elaborates on it in the second video. And this was a wonderful success in restoring his ability to function. He couldn't stand for 10 minutes, given that his lateral ankle pain would increase. And he came out here, and the day after we treated him, he went hiking and did very well, and did a lot of walking around the city and did extremely well. And so it's a really nice case. So here's one paragraph that I pull out of his narrative. I figured I was just going to have to live with it and muddle through for several years, always trying to find a place to sit down so I didn't have to stand for very long. Athletic activities were non-existent other than weight training and biking. And again, he's a personal trainer. I feel like the outside of the entire left foot is bearing too much of the weight when standing, and when I walk, the outer heel strikes and doesn't absorb and does not pronate. I would be happy to stand without pain, but I would love to be able to run too. Running is something I don't even attempt because I know I will pay for it. I now have two young boys, and I so desperately want to be able to chase them around or go to the pool without worrying about how badly my feet are going to hurt the next day, or play basketball with them in a few years. I've long felt that my ailments were related, and that there was an elegant solution, that if someone would treat my whole body, they might find the problem that, if corrected, would help everything else. And he did have low back pain and mid-thoracic pain as well. But so far, doctors only see hallux limitus, meaning podiatrists. Chiropractors only see subluxations. Massage therapists only see muscles. And PTs are only allowed to work on what the doctor says in the prescription. Your whole body approach seems to be exactly what I'm looking for. And in many of your videos, I've seen people with foot range of motion deficits similar to mine suddenly gain range of motion after your treatment. I'm cautiously hopeful that I might see similar results. And you'll go on and see his description of his experience here at Hesch Institute in Aurora, Colorado, for a successful treatment for a chronic lateral foot and ankle pain syndrome that was quite limiting in terms of his tolerance of simply standing and walking, and certainly limited athletic participation. Thank you.